5 little known facts about neuropathy. Number 1, the medications that are typically prescribed have nothing to do with healing. They basically have to do with covering up the symptoms. Some of these medications have even been given to patients that are for epilepsy. They weren't studied on neuropathy. They're not made to heal, they're made to make the patient feel comfortable. Number 2, there are studies out there that show that neuropathy can be healed, that it can be cured, so to speak. There was a study done in the late 90s that looked at nutrition and looked at a vegetarian diet and just walking. And they found that on the upwards of 90% of those patients responded really well to a point where they didn't need medication anymore to manage their symptoms. So there is research out there that shows that neuropathy can be helped. Number 3, there's over 100 different causes to neuropathy. The most common one is diabetes. Probably the second most common one is having to do to chemo from cancer. Another common one is autoimmune diseases, different autoimmune diseases. So there's a lot of different reasons. One of the main subtypes that we treat is one that has a circulatory component, one that has a circulation component, and a lot of them do. Number 4, another little known fact about neuropathy is that your diet matters. Again, with diabetes being the number 1 cause, of course, diet matters with diabetes, so why wouldn't diet matter with neuropathy? It absolutely makes a difference. What you eat contributes or takes away from inflammation, and that's going to affect the symptoms that you feel. And then number 5, the fifth little they'll cut this out, so I'm not worried about it. The fifth little known secret, the fifth secret. What was that? What was I saying? The fifth little known fact. The fifth little known fact is that it's progressive. And what does that mean? It means that in general, neuropathy gets worse. It doesn't get better unless there's some type of intervention, unless there's some type of intentional effort to help your nerves heal. It's not going to get better. It's going to be worse. If you have a question about where you're at or where you're starting, you contact our office, reach out, and we could find out whether or not you could even be helped.